When I was looking for a program to go to residency in, what really mattered to me was trying to find somewhere that I would feel like I was home in, that felt like the people cared about each other and were going to help each other. And when I came and interviewed at Tulsa, I just had this overwhelming feeling of fitting in and that I was where I should be. And I think that that's true. I've experienced that over the past 4 years, is that we're a small program, but we're a program that really cares about each other. We're small, and so we know that we have to be there for one another.
The residents gave me a very warm welcome. I'll specifically remember that we had the greatest conversations about glasses. So this is one of my 7 pairs that I have now, and it was just great to really sit back, kick back and relax and see that they were interested not only in who you were academically, but who you were personally as an individual.
You will really get a chance to know your faculty and to operate with them on a one-on-one basis.
So I had a baby in my 3rd year of residency, and it was really, it's an incredibly challenging thing to do, to have a baby during residency. To have a baby at all is challenging, but that's what our field's all about. But I felt really well supported by my program. They really cared about me and making sure I had time. I've always felt like people are there for me and they want to help me feel like I'm being a good mom as well as being a good resident, and it's been really nice to not feel like I've had to sacrifice one or the other in my experience here.
It's a pretty small program, both residency-wise, but also you have about 25 to 30 medical students in a class, so it's a small group. You can really work one-on-one and get excellent clinical instruction, get hands-on practice, and really be able to be upfront with patient care and learn a great deal.
One of the things I quickly realized about this program, at first was a little bit intimidating, but since I've grown to love, is the small size of the program and how closely you get to interact with your other residents as well as attendings. One of the big benefits to that, everybody sees your strengths, but they also see your weaknesses. Like I said, it was really scary at first. However, the attendings here really want you to succeed. They want you to learn and become a better doctor. So they're able to point out where the weaknesses are that you have so that you can work on them.
As program director, my mission is to give you, the learner, the most robust program we can. We offer both the best of a university-based program and a community-based program. We have the full resources of the University of Oklahoma to offer in terms of research and collaboration, as well as the size of a community program, which allows you to have one-on-one training with your attendings.
One of the unique attributes that our program has, we're a multi-site program. So there are 3 different hospitals that we practice at depending on whether it's surgery or labor and delivery. We also have the clinic at the University of Oklahoma.
Seeing that the urogyns and the generalists worked very well, so specialties working with generalists very well made me more comfortable in knowing that I was not only going to have a lot of experience in the specialties, but also be very well-rounded in the field of OBGYN.
Tulsa is a very livable city, which means that whenever you are off in those few hours, there's a lot of good things around to do, and you're not completely broke and can do it.
There are a number of activities that one can do in the community. I'm an avid rock climber myself, and we have a really great climbing gym in the area. And then there's a number of really popular music venues in Tulsa. We have the Gathering Place, which is a phenomenal park and outdoor facility where you can have all sorts of gatherings, kind of get out, exercise, get some fresh air when you're not in the hospital.
Our goal is to serve and to train excellent generalist OBGYNs. However, we've had multiple residents that have gone on to pursue fellowships in recent years in maternal fetal medicine, urogynecology, pediatric gynecology, to name a few.
I myself am interested in pursuing fellowship after residency, and one of the things that I really value about this program is the ability to have really close contact, not only with attendings who are generalists, but also we have really close contact and great instruction from attendings who are subspecialty trained. My particular interest is in gynecologic oncology, and we have 4 fabulous gynecologic oncologists who operate in Tulsa. We have contact with them both at their office, but also at all 3 of the major hospitals hospitals in Tulsa and are able to operate one-on-one with them.
I think that if you come here, you have the resources and you have the faculty that care about you and are going to fight for you. And I think that everyone here is an advocate, and if that's what you want to do, that's something you're interested in doing, we're going to help you get there.